Hello everyone, today we'll be discussing biases in healthcare and how social psychological concepts can help explain why unequal treatment may occur, even when healthcare professionals intend to treat everyone fairly. Healthcare decisions should be based on patient symptoms and medical history. However, there are social influences and mental processes that can somehow and sometimes affect how healthcare professionals perceive and treat these patients. I will mostly be focusing on implicit bias, fundamental attribution error, conformity, and obedience. I will also explain how these concepts can work together and discuss possible solutions. Bias in healthcare mostly refers to situations in which patients can receive different treatment based on characteristics that should not determine the quality of their care. Some of these characteristics could include their race, ethnicity, gender, age, disability, socioeconomic status, or mental health history. But bias does not always involve a healthcare worker intentionally discriminating against someone. In many cases, people may genuinely believe they're still being fair while still being influenced by these stereotypes and assumptions. This makes healthcare biases especially important to examine through social psychology because social psychology focuses on how people's thoughts, feelings, and behaviors are influenced by other people. My main argument here is that unequal treatment in healthcare is not always caused by a single openly prejudiced person, and that most of the time it can be done unintentionally. Instead, inequality can develop through these automatic biases or incorrect explanations. First, I will discuss implicit bias and stereotyping. Second, fundamental attribution error. And third, conformity and obedience. Finally, I will explain how these concepts can reinforce one another and suggest social psychology based solutions. First is implicit bias. Implicit biases are automatic attitudes and associations that can influence our judgment without full awareness. These associations can often develop through repeated exposure to cultural stereotypes. And someone can consciously support equality while still having these associations that will influence their behavior. For example, a healthcare professional may consciously believe that every patient deserves equal pain treatment. However, implicit stereotypes may still influence how believable or medically serious a patient appears because implicit bias operates quickly and automatically. It may be influential when healthcare workers are tired, stressed, or distracted with something else and required to make these quick decisions. In healthcare settings, implicit bias can influence communication as well as treatment and diagnoses, and the amount of attention equally serious patients receive. For example, two patients might be experiencing similar levels of pain, but a provider may unconsciously perceive one patient as exaggerating while the other one is more serious. Bias also influences the amount of eye contact a provider can make, how patients' symptoms are explained, whether follow-up questions are asked, or how involved the patient is to be in treatment decisions, excuse me. These small differences may appear minor individually, however, they can have a meaningful effect when they occur repeatedly across healthcare. Patients who feel ignored or judged may also be less comfortable communicating with these healthcare professionals, which can make it more difficult for providers to obtain accurate information. The second concept is fundamental attribution error. The fundamental attribution error occurs when people overestimate personality based explanations for someone's behavior while underestimating situational explanations. In healthcare, a provider might describe a patient as lazy or irresponsible without fully understanding a patient's circumstances. For example, a patient who repeatedly misses their appointments might be viewed as somebody who does not care about their health. However, the patient may have transportation problems, childcare responsibilities, or financial limitations. The patient's behavior is real, but the provider may incorrectly assume it reflects the patient's character rather than their situation. Attribution errors can affect the amount of sympathy, patience, and assistance the patient receives. Like, imagine that a patient has difficulty following a treatment plan. A healthcare professional might assume the patient is careless or unwilling to cooperate. However, the medication may be too expensive, the instructions may be too confusing, or there might be a language barrier that affects the patient. When a healthcare professional makes internal attributions too quickly, they might stop searching for these external barriers that could be addressed and solved. Instead of asking what is preventing the patient from following the treatment, they may conclude that the patient just does not care. That judgment can damage the relationship between the patient and the provider and may result in poor healthcare decisions. Next is conformity and obedience. Conformity occurs when people adjust their behavior or judgments to match a group. Obedience occurs when people just follow the instructions from someone who is viewed as an authority figure. Healthcare environments have a very strong hierarchy. For example, physicians, residents, nurses, technicians, supervisors, and students all have different authority, levels of authority and experience. These hierarchies can be necessary for organization and patient care, but they also make it difficult for low ranking employees to question biased decisions. For example, a student or a new employee may notice that a patient is being treated dismissively. However, they may remain silent because a more experienced member of their team appears to accept that behavior. Normative social influences can help explain why someone might remain silent even when they privately disagree with the group. This influence occurs when people conform because they want to be accepted or to avoid rejection, embarrassment, or conflict. A healthcare worker may worry that challenging a senior provider will make them appear disrespectful or difficult to work with. Informational social influence may occur. If everyone else appears calm and unconcerned, an employee may assume that the situation is acceptable or that the more experienced team member knows something they do not know. As a result, biased behaviors may continue, not because every person agrees with it, but because every person interprets everyone else's silence as approval. These concepts can really reinforce each other negatively. First, an implicit stereotype may influence healthcare professionals' initial perception of a patient. Secondly, the fundamental attribution error may cause the provider to interpret the patient's behavior as evidence of a negative personality trait. Third, other healthcare workers may conform to that interpretation instead of questioning it. Finally, employees with less authority may obey the decision of the supervisor or remain silent because they fear social and professional consequences. The result is that one automatic assumption can become a group's judgment. Once the judgment is repeated in conversation or included in the patient's medical records, it may influence how other future healthcare professionals view the patient. This demonstrates that healthcare bias can be maintained through both individual and social situations. Biases in healthcare can produce several serious consequences. Patients may receive delayed diagnosis, inadequate pain management, or less detailed explanations about their conditions. They may also lose trust in healthcare professionals. A patient who expects to be judged or ignored may avoid appointments. Healthcare bias can therefore create a cycle. Negative experiences cause patients to become less comfortable with the healthcare system, and their discomfort may be interpreted as hostility. This shows why healthcare bias is not merely a problem of hurting feelings. It can affect communication, trust, treatment, decisions, and health outcomes. Social psychology can also help us develop possible solutions. The first solution is increasing awareness of implicit bias. However, awareness alone is not enough. Healthcare workers also need specific strategies to interpret automatic judgments. One strategy is individualization, which means focusing on patient-specific information rather than relying on assumptions about social groups. Perspective taking may also be helpful. Help providers consider the patient's experience and concerns before forming judgments. Another strategy is just slowing down important decisions when possible. Bias may become more influential when people are rushed or stressed. Using structured questions, standardized checklists, and clear treatment guidelines may also reduce the opportunity for personal assumptions to influence decision making. Healthcare organizations should also create an environment where employees can respectfully question without fearing punishment. Instead of relying on one-time bias training, organizations can build accountability into daily procedures. Leaders are especially important because employees often copy their behavior that the authority figure models. When leaders welcome questions, admit uncertainty, and correct biased language, other employees may feel safer doing the same. The goal is not to accuse every healthcare worker of prejudice. The goal is to recognize that all people are vulnerable to automatic thinking and social influence, especially in these stressful environments. In conclusion, bias in healthcare can be understood by applying social psychological concepts. Implicit bias explains how automatic association may influence judgment without conscious intent. The fundamental attribution error explains how healthcare professionals may blame a patient's personality while overlooking barriers such as cost, transportation, work, responsibilities, or confusing instructions. Conformity and obedience explains why employees may accept or remain silent about biased judgments. These concepts overall show that unequal treatment, is not always caused by one intentionally prejudiced person. It can be developed by ordinary people processing information within a powerful social environment. Reducing healthcare bias requires both individual effort and changes to healthcare systems. By encouraging perspective taking, structured decision making, open communication, and respectful questioning of authority, healthcare organizations can create a fair and more patient-centered care. Thank you for listening.